Hello! This video will provide an introduction to misinformation and disinformation during public health emergencies. When a public health emergency occurs in the US, it's common to see a wide range of health related narratives going around. Often, people have questions, concerns, or a lack of information about a public health issue. But other times, you might confront more difficult to change misinformation and disinformation. You can probably think of several rumors you heard during the COVID-19 pandemic or other health related emergencies. Reducing the spread of misinformation and disinformation is important for building trust in public health emergency preparedness and response. Misleading rumors and misinformation create confusion during public health emergencies and reduce public trust in authorities who are trying to respond. And it's not just words, there are real impacts on health behaviors and outcomes. When people hear vaccine related misinformation and disinformation, they may not get vaccinated, which reduces protection against vaccine preventable diseases. When rumors confuse people about where to go and what to do during a natural disaster, they may not have access to the services that they need. So it's important to reduce the spread of health related rumors and misinformation to improve public health emergency preparedness and response. When we talk about misinformation, we're usually referring to the spread of inaccurate or misleading information. It could be partially false or completely false. Part of the message could be true, but it could be framed in a way that's misleading. It could even be an honest mistake. Disinformation, however, usually refers to the intentional and deliberate spread of false or misleading information. Our team uses the word rumors rather than misinformation and disinformation because people are often coming across claims where we don't know whether they're true or false, especially during times of crisis or a public health emergency. Here's another term you might hear, infodemic. It refers to too much information, especially false or misleading information, circulating physically and digitally during a disease outbreak. This can prolong an outbreak and make it more difficult to respond to it effectively. It's become easier than ever to spread misinformation and disinformation, especially because we rely on digital platforms and social media to communicate with each other. The term infodemic accounts for how operating in a digital environment has changed how we detect misinformation, how we respond to it, and the impact that misinformation has on communities.
There are many reasons why misinformation and disinformation spread during public health emergencies. Sometimes people's cognitive biases lead them to misinterpreting information, or their social, cultural, or political motivations may influence them. Or they might just misunderstand scientific guidance. You might have noticed, though, that some types of rumors seem to keep coming up whenever there is a public health emergency. Seeing which rumors come up over and over again could potentially help us prepare to tackle them when they come up again in the future.
To understand patterns and themes of these rumors, the Trust in Public Health Project team conducted a content analysis of hundreds of rumors over a range of past public health emergencies, spanning infectious diseases, natural disasters, and other crises like the opioid epidemic. These rumors fell into three overarching and overlapping categories: culture-related misinformation, communication-related misinformation, and cognition-related misinformation. Culture-related misinformation refers to rumors that are rooted in social, political, and cultural beliefs and practices, like socio-cultural narratives, beliefs that people hold strongly, and biases that they have. Culture-related misinformation could look like beliefs about vaccines being harmful, the government being untrustworthy, harms to your fertility, conspiracy theories, scapegoating people, and rumors driven by apathy towards a crisis. Communication-related misinformation includes rumors that spread because of issues with how accurately and effectively we share information with people. This could be because communicators are framing information in a bad way, or there's constantly changing guidance, or because people simply misrepresent issues by misleading, downplaying, inflating, and cherry-picking information. This category also includes rumors around false or unproven cures, and people's lack of understanding of public health guidance. Cognition-related misinformation is all about rumors that spread because of how people think, how they process new information, and use mental shortcuts to make sense of everything they experience. There are all kinds of cognitive biases that make some types of rumors so sticky. People might jump to conclusions when trying to clarify uncertainty, or think that other people are more easily influenced than them, or interpret information in a way that confirms what they already believe. They might even feel overconfident when experiencing a public health crisis.
We believe that understanding rumors can prepare us to better anticipate them and then address them. When we plan ahead for these rumors and their potential impact on trust, we can strengthen trust in public health preparedness and response. Thanks for watching. We'd like to thank the research team and experts who have contributed to this work. To learn more about this analysis and ways to build trust or address misinformation and disinformation, go to our Trust in Public Health website.